This is our final video of Chapter 5. We'll be talking about how tissues grow and develop, how they repair injuries, and how they degenerate and ultimately die. We're going to talk about the differences between different modes of tissue growth. We'll define adult and embryonic stem cells and talk about the differences between them. We'll talk about how a tissue type can change from one to another. We'll talk about a couple ways that cells can shrink and ultimately die, and we'll look at how tissues repair themselves. Tissue growth can happen in two ways. We can have hyperplasia, which is when the number of cells increases, and we can have hypertrophy, which is when the same number of cells is there, but the cells increase in size. So hyperplasia is increase in cell number, and hypertrophy is increase in cell size. Hypertrophy is easy for us to relate to if you've ever seen someone who has very large biceps because they've been spending a lot of time at the gym, or they have a job where they are very physically active. Those muscle cells get bigger as they're used more. We can also see hypertrophy in the accumulation of body fat. We talked about this when we talked about adipose tissue. We have a fairly constant number of adipose cells, adipocytes, in our bodies, but those adipocytes can increase in size if they're storing more fat for energy, or decrease in size as we store less fat for energy. Neoplasia is the development of a tumor, whether it's a benign tumor or a malignant cancerous tumor. Neoplasia is abnormal tissue that is either non-functional or is not doing a function that helps the body. Tissues can sometimes change their type. This happens in normal development in some cases. So for instance, you guys know that newborns' bones are softer than adult bones, and adult bones, as a person ages, become more and more brittle. So that's an example of tissue development and differentiation over time. So now we're going to talk a little bit about stem cells. So stem cells are undifferentiated cells, and stem cells don't have a specialized function. They can mature into one or more different functional cell types. And this is what I study. I study hematopoiesis, which is how hematopoietic stem cells in the body, they're in the bone marrow, differentiate into red blood cells, the various white blood cells, platelets, and plasma, and also T and B cells. So stem cells themselves don't have a function. Their only function is regenerating their own population and differentiating into other cells that have functions. Stem cells have what we call developmental plasticity, which means they can mature into several different things. So let me give you a very quick analogy here. Imagine a newborn baby. And this newborn baby, if it's a healthy, normal newborn, is not differentiated in terms of what career it could have when it grows up. As it gets older and the child has access to different opportunities, different nutrition, different educational opportunities, it becomes more specialized. Okay? For instance, at this point in my life, my career is not set in stone. I have missed the window I will ever become a ballerina. At this point in my life, that is not a possibility for me. I have differentiated in a different direction. So a stem cell is like that newborn baby, where they could become anything they want to be. And as the baby matures, its possibilities for careers become more and more narrow. That doesn't mean they're locked into any one career, but as we develop and mature, our path is more set into a certain specialty. And it's similar with stem cells. Stem cells can become many, many different cell types. As they mature, what they can differentiate into becomes more and more narrow. We have two different types of stem cells. We have embryonic stem cells and adult stem cells. So embryonic stem cells, we have two varieties of them. We have totipotent, and totipotent embryonic stem cells are found only in a very early embryo. And then pluripotent stem cells are found slightly later in embryonic development. Okay, so these are the stem cells that there's significant controversy surrounding, and we'll talk more about that in a little while. Adult stem cells are stem cells that adult organisms still maintain. So you yourself have adult stem cells. Your adult stem cells are found in several different places in your body. The hematopoietic stem cells that I study are found mostly in your bone marrow. And they are undifferentiated to some degree. They are more differentiated than the totipotent and pluripotent embryonic stem cells. But adult stem cells do have some ability to differentiate still. So multipotent are things that can develop into 2 or more cell lines. So bone marrow stem cells, like what I study, are an example of this. Then unipotent, things that can only develop into one specific cell type. So now we're going to talk about tissue repair. We have 2 ways that we can repair tissue in general. We have regeneration and fibrosis. So regeneration is when we replace the dead or damaged cells with exactly what was there to begin with. And this gives back normal function. We may have some scarring, but generally it's very minor. So we have regeneration of a child who skins their knee. We have regeneration of a person who has a short infection that causes damage to the liver. Fibrosis is when we replace damaged cells with scar tissue. Okay, so think of, for instance, a person who unfortunately experiences a severe burn. They're going to have some scar tissue on their skin. Or imagine someone who has liver damage from years and years and years of alcohol abuse. They're going to have significant liver damage that very possibly will include scarring or fibrosis. Let's talk through the stages of how a skin wound heals. So we're talking about a minor wound here, like you're cutting vegetables for supper and you have a small cut. A skinned knee would be like this. A very minor burn would heal in this way. Okay, so if we have a cut to the skin, any blood vessels that have been severed are going to bleed. And then we're going to have mast cells, which are found circulating in the bloodstream, come to the damaged cells, and they're going to release something called histamine. And histamine does several things, but one thing that it does is it's going to dilate the blood vessels, and that will make the capillaries more permeable, so different things can come through in the next couple steps. Blood plasma, remember plasma is the ground substance of the blood. Blood plasma is going to come into the wound, and it's going to bring with it antibodies and also proteins that promote clotting. Then the clot is going to form, and the clot holds the edges of the cut together. It keeps them physically together. And it also kind of forms a plug that's going to keep pathogens out. The clot will harden into a scab that seals off the wound and is going to further keep pathogens out. And any pathogens that did get into the wound, because remember bacteria are so tiny and there's so many of them, any bacteria that did get into the wound, another cell type called macrophages are going to come in and ingest those pathogens, and also any debris, if there was any small pieces of dirt or dust that got into the wound. It's going to digest those things by phagocytosis. Then we're going to have new capillaries built. Those are going to form by angiogenesis from the surrounding capillaries. The deeper portions of the clot are going to start to gain capillaries and also fibroblasts, and that's going to help the tissue to rebuild. We're going to have collagen. Remember, collagen is a very important structural protein that's going to be developed. And depending on the severity of the wound, this can take a couple days to a couple weeks. And finally, the epithelial cells that are on the edges of the wound and below the wound are going to multiply, and they're going to kind of migrate to beneath that scab. I'm sure you guys have at some point had a scab, and then the scab peels off and there's that new skin underneath. That's what's going on here. The connective tissue is going to undergo fibrosis. Remember, fibrosis is scar tissue forming. So again, if this was a very minor injury, a minor cut to the skin, that fibrosis may only be detectable in the lower layers. We might not be able to see it all the way through the upper layers of the epithelium. So this healing process could take a very short time, sometimes just a couple days or a couple weeks, but it can take a much longer time if the injury is more severe or if some part of this healing process is impaired. Tissue engineering is a relatively new technology that is allowing us to assist the body in repairing with the use of biotechnology. So one of these that you guys may have seen pictures of is growing a replacement ear inside of a mouse. There's a picture of it on the next slide. So if we use a framework and put that framework into what we call a bioreactor, such as a mouse, that can give all the nutrients and oxygen to the growing tissue, we can actually grow new tissues this way. So skin grafts, we do this all the time with skin grafts. It's fairly common for burn victims and people who have other large-scale surgeries or injuries. We have ongoing research getting closer and closer to functional tissue engineering with heart valves for replacing damaged or diseased heart valves, coronary arteries, bones, liver, and tendons, and the really famous picture, the mouse with the ear growing. Okay, so now we're moving on to cell degeneration and cell death. Okay, so atrophy can happen normally with aging because of loss of some growth factors and other normal aging processes. It's harder to maintain muscle mass as a person gets older. And this normal process is called senile atrophy. When we have atrophy from disuse, we call that disuse atrophy. I saw this very personally. My mother a few years ago was very, very sick, and she was in a coma for 16 days. And then it was a couple weeks after she came out of the coma before she was able to stand and walk and start taking care of herself. And in that about a month period, her muscles atrophied severely. And she had to spend several months doing rehab work to learn how to walk again because her muscles had atrophied. So that's how tissues degenerate. Now, necrosis. So necrosis is tissue death, and it can happen for lots of different reasons. So if the blood supply is cut off, we can have infarction, and that will cause tissue death. If you've ever seen, for instance, someone who has a tight rubber band or other sort of tight thing around their wrist or their ankle for an extended period of time, that can actually cause cell and tissue death if the hand or the foot doesn't get adequate blood supply. We also have gangrene. There are several different types of gangrene. Gangrene usually comes as the result of an infection. Dry gangrene is pretty common in people who have diabetes, and it can cause damage, especially to toes and feet. If you know of anyone with diabetes who had a toe or a foot amputated, dry gangrene may be the cause there. Bed sores or pressure sores, individuals who are in nursing homes, that oftentimes, is a form of dry gangrene. This is absolutely horrifying and gross, but wet gangrene happens when infection causes internal organs to liquefy and degenerate completely. And gas gangrene, this one is famous for Civil War accounts, when we have injuries that are in a dirty, unsanitary, can't sanitize environment, such as a battlefield. Gas gangrene is often the result, and you have heard, I'm sure, Civil War accounts of people getting amputated arms and legs. Gas gangrene was the cause of that. All right, so moving from tissue death to cell death. So apoptosis is the name of normal cell death. Our cells don't live forever. Some undergo mitosis much more frequently than other cell types, but our cells don't live forever. So normal programmed cell death is called apoptosis. Very, very important word. Definitely know that one for an exam. When a cell is not functioning at its most optimum level, it is programmed to essentially commit suicide. That's what we think of apoptosis as. The cell dies and is out of the way and allows healthier cells to regenerate in that place. Once a cell undergoes apoptosis, it is phagocytized, macrophages or other cells that do phagocytosis, and the cell is engulfed and then broken down into its individual components that may be recycled or may be eliminated as waste. Billions of cells die from apoptosis. This is normal. This is part of your body keeping itself healthy. So now we're going to go just a little bit deeper into stem cell controversy. So we have politicians who disagree with or agree with using embryonic stem cells. We have religions that weigh in on the use of embryonic stem cells. The use of embryonic stem cells has enormous potential for treating Parkinson's, brain cell loss, diabetes, because embryonic stem cells can differentiate into all of those cell types. Adult stem cells are a lot more limited in what they can differentiate into. So where we get into sticky issues is, how do we get embryonic stem cells? Well, there are two ways. Initially, embryonic stem cells could be harvested from aborted fetuses. Generally, in fact, as a rule, that's not how embryonic stem cells are obtained now. Embryonic stem cells are now donated by couples who have many cells fertilized during the process of in vitro fertilization, a fewer number implanted. So if a couple is trying to have a child by in vitro fertilization, they may have 10 to 20 egg cells fertilized by sperm cells, but only 2 to 3 implanted in the uterus. Those other cells could be donated, the other fertilized cells could be donated and allowed to develop through early stages, and then embryonic stem cells used in research. So this is controversial. It's not a cut and dry topic. There are people who have strong opinions about when the definition of life starts. If you are in the camp that life starts as soon as the sperm cell penetrates the egg cell. Possibly embryonic stem cell may seem like a disrespectful or inappropriate source of embryonic stem cells. If that's not your opinion, you may be more okay with the use of embryonic stem cells in research. There isn't a right answer on this. So, stem cells have a lot of ethical issues, legal issues. There are some interesting court cases that have come up as a result of this as well.